Hey, Alpha Nurses, I'm Licensure from alphanursesguy.com. These are NCLEX practice questions. Without delay, let's get started.
The client with vasospastic disorder, Raynaud's phenomenon, has coldness and numbness in the fingers. The nurse assesses the client for effects of vasoconstriction. Which of the following is an early sign of vasoconstriction? 1. Cyanosis. 2. Gangrene. 3. Pallor. 4. Rubor. The correct answer is 3. Initially, the vasoconstriction effect produces pallor or a whitish coloring, followed by cyanosis and finally rubor. Gangrene is the end result of complete arterial occlusion. The skin is blackened and without a blood supply. During an initial assessment of a client diagnosed with vasospastic disorder, Raynaud's phenomenon, the nurse notes a sudden color change from pink to white in the fingers. The nurse should first assess 1. Appearance of cyanosis. 2. Radial pulse. 3. Oxygen saturation of the affected fingers. 4. Blood pressure. The correct answer is 2. Decreased perfusion from vasospasm induces color changes in the extremity. The degree of decreased perfusion should be assessed by taking the radial pulse. Color changes progressively to blue with cyanosis and then red when reperfusion occurs. The oxygen saturation requires adequate perfusion for accuracy. A blood pressure will cause further constriction and reduction of perfusion in the extremity. The nurse should instruct a client who has been diagnosed with vasospastic disorder, Raynaud's phenomenon, to 1. Immerse the hands in cold water during an episode. 2. Wear light garments when the temperature gets below 50 degrees Fahrenheit. 3. Wear gloves when handling ice or frozen foods. 4. Live in a cold climate. The correct answer is 3. Extreme changes in temperature can precipitate a vasospastic episode and should be avoided by clients with vasospastic disorder, Raynaud's disease. The client should be encouraged to wear gloves when handling frozen foods or ice. The client should immerse the involved extremity in warm water during an episode to promote vasodilation and relaxation of the small arteries that are in spasm. The client can help prevent vasospasm brought on by temperature changes by wearing warm clothes. Living in a cold climate will exacerbate the symptoms. In order to prevent recurrent vasospastic episodes with Raynaud's phenomenon, the nurse should instruct the client to 1. Keep the hands and feet elevated as much as possible. 2. Use a vibrating massage device on the hands. 3. Wear gloves when obtaining food from the refrigerator. 4. Increase coffee intake to 2 cups per day. The correct answer is 3. Loose, warm clothing should be worn to protect from the cold. Wearing gloves when handling cold objects will help prevent vasospasms. Vibrating equipment and typing contribute to vasospasm. Tobacco and caffeine should be avoided. Elevation will decrease arterial perfusion during vasospasms. A client with Raynaud's phenomenon is prescribed diltiazem. An expected outcome is 1. Decreased heart rate. 2. Conversion to normal sinus rhythm. 3. Reduced episodes of finger numbness. 4. Increased SpO2. The correct answer is 3. Calcium channel blockers are first-line drug therapy for the treatment of vasospasms with Raynaud's phenomenon when other therapies are ineffective. Cardizem relaxes smooth muscles and improves peripheral perfusion, therefore reducing finger numbness. Cardizem decreases heart rate and is used to treat atrial fibrillation, but these are not associated with Raynaud's. When vasospasms are prevented, an accurate SpO2 can be measured in the affected extremity. However, SpO2 is a measurement of systemic oxygenation not influenced by cardizem. When giving discharge instructions to the client with vasospastic disorder, Raynaud's phenomenon, the nurse should explain that the expected outcome of taking a beta-adrenergic blocking medication is to control the symptoms by 1. Decreasing the influence of the sympathetic nervous system on the tissues in the hands and feet. 2. Decreasing the pain by producing analgesia. 3. Increasing the blood supply to the affected area. 4. Increasing monoamine oxidase. The correct answer is 1. Beta-adrenergic medications block the beta-adrenergic receptors. Therefore, the expected outcome of the medication is to decrease the influence of the sympathetic nervous system on the blood vessels in the hands. Beta-adrenergic blockers have no analgesic effects. Increasing blood supply to the affected area is an indirect effect of beta-adrenergic blockers. They do not increase monoamine oxidase, which does not play a role in Raynaud's disease. A client with vasospastic disorder, Raynaud's phenomenon, is considering having a sympathectomy. This nurse should tell the client that the surgery is performed 1. In the early stages of the disease to prevent further circulatory disturbances. 2. When the disease is controlled by medication. 3. When the client is unable to control stress-related vasospasm. 4. When all other treatment alternatives have failed. The correct answer is 4. Sympathectomy is scheduled only after other treatment alternatives have been explored and have failed. Medication and stress management are beneficial strategies to prevent advancement of the disease process. If the disease is controlled by medication, there is no reason for surgery. A client with pernicious anemia asks why it is necessary to take vitamin B12 injections forever. Which is the nurse's best response? 1. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient acid. 2. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient intrinsic factor. 3. The reason for your vitamin deficiency is an excessive excretion of the vitamin because of kidney dysfunction. 4. The reason for your vitamin deficiency is an increased requirement for the vitamin because of rapid red blood cell production. The correct answer is 2. Most clients with pernicious anemia have deficient production of intrinsic factor in the stomach. Intrinsic factor attaches to the vitamin in the stomach and forms a complex that allows the vitamin to be absorbed in the small intestine. The stomach is producing enough acid. There is not an excessive excretion of the vitamin, and there is not a rapid production of red blood cells in this condition. A woman of African descent had experienced severe palpitations, weakness, and shortness of breath after taking bacitracin. As a part of the discharge planning, the nurse should evaluate the client's knowledge about 1. Increased folic acid needs. 2. Congenital enzyme deficiency. 3. Restricted activity in hot weather. 4. Need for blood transfusions. The correct answer is 2. This client presented with the typical signs of glucose 6-phosphate dehydrogenase, aka G6PD, deficiency anemia. 10% of blacks inherit an X-linked recessive disorder of the G6PD enzyme in the red blood cell. When cells with decreased levels of G6PD are exposed to certain drugs, such as sulfonamides, acetylsalicylic acid, thiazide diuretics, and vitamin K, the RBC may hemolyze and anemia and jaundice may occur. The reaction is self-limited as soon as the causative agent is withheld. No further treatment is necessary except counseling to prevent acute incidents by avoiding exposure to specific drugs. There is no need for increased folic acid, restricted activity in hot weather, or blood transfusions. The nurse is assessing a client's activity tolerance by having the client walk on a treadmill for 5 minutes. Which of the following indicates an abnormal response? 1. Pulse rate increased by 20 beats per minute immediately after the activity. 2. Respiratory rate decreased by 5 breaths per minute. 3. Diastolic blood pressure increased by 7. 4. Pulse rate within 6 beats per minute of resting pulse after 3 minutes of rest. The correct answer is 2. The normal physiologic response activity is an increased metabolic rate over the resting basal rate. The decrease in respiratory rate indicates that the client is not strong enough to complete the mechanical cycle of respiration needed for gas exchange. The post-activity pulse is expected to increase immediately after activity, but by no more than 50 beats per minute if it is strenuous activity. The diastolic blood pressure is expected to rise, but by no more than 15. The pulse returns to within 6 beats per minute of the resting pulse after 3 minutes of rest. In a postoperative client, The hematocrit decreased from 36% to 34% on the third day, even though the red blood cell count and hemoglobin value remained stable at 4.5 millions per microliter and 11.9 grams per deciliter, respectively. The nurse should next 1. Check the dressing and drains for frank bleeding. 2. Call the physician. 3. Continue to monitor vital signs. 4. Start oxygen at 2 liters per minute per nasal cannula. The correct answer is 3. The nurse should continue to monitor the client because this value reflects a normal physiologic response. The physician does not need to be called, and oxygen does not need to be started based on these laboratory findings. Immediately after surgery, the client's hematocrit reflects a falsely high value related to the body's compensatory response to the stress of sudden loss of fluids and blood. Activation of the intrinsic pathway and the renin-angiotensin cycle via antidiuretic hormone produces vasoconstriction and retention of fluid for first 1 to 2 days post-operatively. By the 2nd to 3rd day, this response decreases, and the client's hematocrit level is more reflective of the amount of RBCs in the plasma. Fresh bleeding is a less likely occurrence on the 3rd postoperative day, but is not impossible. However, the nurse should have expected to see a decrease in the RBC count and hemoglobin value accompanying the hematocrit. The nurse is administering packed red blood cells to a client. The nurse should first 1. Discontinue the IV catheter if a blood transfusion reaction occurs. 2. Administer the PRBCs through a percutaneously inserted central catheter line with a 20-gauge needle. 3. Flush PRBCs with 5% dextrose and 0.45% normal saline solution. 4. Stay with the client during the first 15 minutes of infusion. The correct answer is 4. The most likely time for a blood transfusion reaction to occur is during the first 15 minutes or first 50 milliliters of the infusion. If a blood transfusion reaction does occur, it is imperative to keep an established IV line so that medication can be administered to prevent or treat cardiovascular collapse in case of anaphylaxis. PRBC should be administered through a 19-gauge or larger needle. A peripherally inserted central catheter line is not recommended in order to avoid a slow flow. RBCs will hemolyze in dextrose or lactated ringer solution and should be infused with only normal saline solution. The nurse should instruct a young female adult with sickle cell anemia to do which of the following? Select all that apply. 1. Drink plenty of fluids when outside in hot weather. 2. Avoid being in high altitudes. 3. Be aware that since she is homozygous for hemoglobin S, she carries the sickle cell trait. 4. Know that pregnancy with sickle cell disease increases the risk of a crisis. 5. Avoid flying on commercial airlines. The correct answers are 1, 2, and 4. The nurse should teach the client to drink plenty of fluids to avoid becoming dehydrated. The client should avoid being in high altitudes, such as mountains above 5,000 feet, where there is less oxygen in the air, which may precipitate a sickle cell crisis. The nurse should alert young women with sickle cell anemia that pregnancy increases the risk of a crisis. People who are homozygous for hemoglobin S have sickle cell anemia. The heterozygous form is the sickle cell carrier trait. A client with sickle cell anemia may fly on commercial airlines. The airplane is pressurized and has an adequate oxygen level. The nurse is teaching a client and his family about the client's new diagnosis of hemochromatosis. Which of the following details should the nurse include? 1. Hemochromatosis is an autoimmune disorder that affects the HFE gene. 2. Individuals who are heterozygous for hemochromatosis rarely develop the disease. 3. Individuals who are homozygous for hemochromatosis are carriers of hemochromatosis. 4. Men are at greater risk for hemochromatosis. The correct answer is 2. The nurse should teach the client and family that individuals who are heterozygous for hemochromatosis rarely develop the disease. Men and women are equally at risk for hemochromatosis, but men are diagnosed earlier because women do not usually have manifestations until menopause. Hemochromatosis is the most common genetic disorder in Canada and the United States. Individuals who are homozygous for hemochromatosis receive a defective gene from each parent. Those with homozygous genes may develop the disease. A client is having a blood transfusion reaction. The nurse must do the following in what order of priority from first to last? 1. Notify the attending physician and blood bank. 2. Complete the appropriate transfusion reaction forms. 3. Stop the transfusion. 4. Keep the IV open with normal saline infusion. The correct order is 3, 4, 1, and 2. When the client is having a blood transfusion reaction, the nurse should first stop the transfusion and then keep the IV open with normal saline infusion. Next, the nurse should notify the physician and blood bank, then complete the required forms regarding the transfusion reaction. Which safety measures will be most important to implement when caring for a client who is receiving 2 units of packed red blood cells? Select all that apply. 1. Verify that the ABO and RH of the 2 units are the same. 2. Infuse a unit of PRBCs in less than 4 hours. 3. Stop the transfusion if a reaction occurs, but keep the line open. 4. Take vital signs every 15 minutes while the unit is transfusing. 5. Inspect the blood bag for leaks, abnormal color, and clots. 6. Use a 22-gauge catheter for optimal flow of a blood transfusion. The correct answers are 2, 3, and 5. The American Association of Blood Banks and Canadian Blood Services recommend that 2 qualified people, such as 2 licensed nurses, compare the name and number on the identification bracelet with the tag on the blood bag. Verifying that the 2 units are the same is not a recommendation. Rather, the verification is always with the client, not with bags of blood. A unit of blood should infuse in 4 hours or less to avoid the risk of septicemia, since no preservatives are used. When a blood transfusion reaction occurs, the blood transfusion should be stopped immediately, but the 4 lines should be kept open so that emergency medications and fluids can be administered. The unit of PRBC should be inspected for contamination by looking for leaks, abnormal color, clots, and excessive air bubbles. When a unit of PRBCs is being transfused, vital signs are assessed before the transfusion begins, after the first 15 minutes, and then every hour until 1 hour after the transfusion has been completed. When PRBCs are being administered, a 20-gauge or larger needle is needed to avoid destroying the red blood cells passing through the lumen and to allow for maximal flow rate. A client who had received 25 milliliters of packed red blood cells has low back pain and pruritus after stopping the infusion. The nurse should take what action next? 1. Administer prescribed antihistamine and aspirin. 2. Collect blood and urine samples and send to the lab. 3. Administer prescribed diuretics. 4. Administer prescribed vasopressors. The correct answer is 2. ABO and RH incompatible blood causes an antigen-antibody reaction that produces hemolysis or agglutination of red blood cells. At the first indication of any sign/symptom of reaction, the blood transfusion is stopped. Blood and urine samples are obtained from a client and sent to the lab along with the remaining untransfused blood. Hemoglobin in the urine and blood samples taken at the time of the reaction provide evidence of a hemolytic blood transfusion reaction. Antihistamine, aspirin, diuretics, and vasopressors may be administered with different types of transfusion reactions. A client is to receive EPOIN injections. What laboratory value should the nurse assess before giving the injection? 1. Hematocrit. 2. Partial thromboplastin time. 3. Hemoglobin concentration. 4. Prothrombin time. The correct answer is 1. EPOIN is a recombinant DNA form of erythropoietin, which stimulates the production of red blood cells and therefore causes the hematocrit to rise. The elevation in hematocrit causes an elevation in the blood pressure. Therefore, the blood pressure is a vital sign that should be checked. The partial thromboplastin time, hemoglobin level, and prothrombin time are not monitored for this drug. When beginning IV erythropoietin therapy, the nurse should do which of the following? Select all that apply. 1. Check the hemoglobin levels before administering subsequent doses. 2. Shake the vial thoroughly to mix the concentrated white, milky solution. 3. Keep the multi-dose vial refrigerated between scheduled twice-a-day doses. 4. Administer medication through the IV line without other medications. 5. Adjust the initial doses according to the client's changes in blood pressure. 6. Instruct the client to avoid driving and performing hazardous activity during the initial treatment. The correct answers are 4, 5, and 6. Erythropoietin is administered to decrease the need for blood transfusions by stimulating red blood cell production. The medication should be administered through the IV line without other medications to avoid a reaction. The hematocrit, a simple measurement of the percentage of RBCs in the total blood volume, is used to monitor this therapy. When initiating IV erythropoietin therapy, the nurse should monitor the hematocrit level so that it rises no more than 4 points in any 2-week period. In addition, the initial doses of erythropoietin are adjusted according to the client's changes in blood pressure. The nurse should tell the client to avoid driving and performing hazardous activity during the initial treatment due to possible dizziness and headaches secondary to the adverse effect of hypertension. The hematocrit, not the hemoglobin level, is used for monitoring the effectiveness of therapy. The vial of erythropoietin should not be shaken because it may be biologically inactive. The solution should not be used if it is discolored. The nurse should not re-enter the vial once it has been entered. It is a one-time use vial. All remaining erythropoietin should be discarded since it does not contain preservatives. A client is afraid of receiving vitamin B12 injections because of potential toxic reactions. Which is the nurse's best response to relieve these fears? 1. Vitamin B12 will cause ringing in the ears before a toxic level is reached. 2. Vitamin B12 may cause a very mild rash initially. 3. Vitamin B12 causes mild nausea, but nothing toxic. 4. Vitamin B12 is generally free of toxicity because it is water-soluble. The correct answer is 4. Vitamin B12 is a water-soluble vitamin. When water-soluble vitamins are taken in excess of the body's needs, they are filtered through the kidneys and excreted. Vitamin B12 is considered to be non-toxic. Adverse reactions that have occurred are believed to be related to impurities or to preservative in B12 preparations. Ringing in the ears, rash, and nausea are not considered to be related to vitamin B12 administration. A client with microcytic anemia is having trouble selecting food from the hospital menu. Which food is best for the nurse to suggest for satisfying the client's nutritional needs? 1. Egg yolks. 2. Brown rice. 3. Vegetables. 4. Tea. The correct answer is 2. Brown rice is a source of iron from plant sources. Other sources of non-heme iron are whole grain cereals and breads, dark green vegetables, legumes, nuts, dried fruits, oatmeal, and sweet potatoes. Egg yolks have iron, but it is not as well absorbed as iron from other sources. Vegetables are a good source of vitamins that may facilitate iron absorption. Tea contains tannin, which combines with non-heme iron, preventing its absorption. A client with macrocytic anemia has a burn on the foot and reports watching television while lying on a heating pad. Which action should be the nurse's first response? 1. Assess for potential abuse. 2. Check for diminished sensations. 3. Document the findings. 4. Clean and dress the area. The correct answer is 2. Macrocytic anemias can result from deficiencies in vitamin B12 or ascorbic acid. Only vitamin B12 deficiency causes diminished sensations of peripheral nerve endings. The nurse should assess for peripheral neuropathy and instruct the client in self-care activities for diminished sensation to heat and pain. The burn could be related to abuse, but this conclusion would require more supporting data. The findings should be documented, but the nurse will want to address the client's sensations first. The decision of how to treat the burn should be determined by the physician. Which of the following is a late symptom of polycythemia vera? 1. Headache. 2. Dizziness. 3. Pruritus. 4. Shortness of breath. The correct answer is 3. Pruritus is a late symptom that results from abnormal histamine metabolism. Headache and dizziness are early symptoms from engorged veins. Shortness of breath is an early symptom from congested mucous membranes and ineffective gas exchange. The nurse is teaching a client with polycythemia vera about potential complications from this disease. Which manifestations should the nurse include in the client's teaching plan? Select all that apply. 1. Hearing loss. 2. Visual disturbance. 3. Headache. 4. Orthopnea. 5. Gout. 6. Weight loss. The correct answers are 2, 3, 4, and 5. Polycythemia vera, a condition in which too many red blood cells are produced in the blood serum, can lead to an increase in the hematocrit and hypervolemia, hyperviscosity, and hypertension. Subsequently, the client can experience dizziness, tinnitus, visual disturbances, headaches, or feeling of fullness in the head. The client may also experience cardiovascular symptoms, such as heart failure, and increased clotting time or symptoms of an increased uric acid level, such as painful, swollen joints. Hearing loss and weight loss are not manifestations associated with polycythemia vera. When a client is diagnosed with aplastic anemia, the nurse should assess the client for changes in which of the following physiologic functions. 1. Bleeding tendencies. 2. Intake and output. 3. Peripheral sensation. 4. Bowel function. The correct answer is 1. Aplastic anemia decreases the bone marrow production of red blood cells, white blood cells, and platelets. The client is at risk for bruising and bleeding tendencies. A change in the client's intake and output is important, but assessment for the potential for bleeding takes priority. Change in the peripheral nervous system is a priority problem specific to clients with vitamin B12 deficiency. Change in bowel function is not associated with aplastic anemia.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.